mention that to everybody.
Figured it wasn't that complicated.
Well, thank you, everybody. So I'm so sorry for this minor delay. We're just making sure, as technology welcomes us, that we have all of our team here. We've actually made a great deal of effort to be prepared, but as it goes, there's always that last challenge. Perhaps I'll try to speak, not just filling space. I'll introduce myself. My name is Renee Mashing, and I am, my bloodlines are from Six Nations of the Grand River in Southern Ontario. I'm also Irish descent, and I have the great honor and privilege of working with CAAN, Communities, Alliances, and Networks. And this is a national organization that serves Indigenous people with living and lived experience of STBBI, with a focus particularly related to HIV and hepatitis C. And we have an amazing team of highly respected speakers joining us today, speaking about a variety of aspects of our work and the ways that we approach, particularly working on research activities, but also some of our international engagement initiatives. So it is my privilege to moderate the session and to welcome and introduce our speakers. I'm going to let each of you do your own introduction, but I'll call you into the presentation. And as we're beginning this work, we certainly, deeply value and appreciate the importance of acknowledging the territories where we are coming together. And so I understand, and thank you, Jessica, for confirming that each day of the conference begins with territorial acknowledgement. And as Indigenous peoples from Canada and from Mexico, or well, from South America, excuse me, some of our speakers, we certainly appreciate and understand that part of that acknowledgement of territory is actually acknowledgement of the territories where we live and reside on Turtle Island. And so it's special and important to us to have that opportunity to acknowledge that this is the land of our ancestors, and that we share and gather together. Also to acknowledge that, of course, while we come from many different territories, when we would visit and travel across each other's territories, we would respectfully acknowledge those places that we were entering. So while Turtle Island is our homeland and the place of our ancestors would greet each other respectfully. And so in that regard, I see a note just below that somebody might be able to help Margaret. And if somebody, Tim, maybe if you could help follow up on that. Just in that regard of acknowledging territory, I'm calling in from the east coast of Canada, from Mi'kma'ki, and I'm an uninvited guest here in this territory, and I very respectfully appreciate the opportunity to be here and place my footsteps here in this special place, and to be part of it, and appreciate that each of us can bring those acknowledgements and appreciation. And Margaret, your timing is absolutely perfect. It's so wonderful to see your face. So you are going to be our first speaker to help set up our presentation and the context of all the work that we're doing within CAAN and that gets a highlight today. And I will turn it over to you. Thank you. Welcome.
Thank you so much. Margaret Kisika Piesis, and that means daybird in Cree. And I took back my family name a few years back, and that was the name of my ancestors on this land. I'm Cree from the province called Saskatchewan, and my ancestors are all over the place, as Cree people are. And I'm very delighted and happy to greet you today and to bring along with me my ancestors as we begin to talk about Pamaso and life moving forward in the work that we do at CAAN, Communities, Alliances, and Networks. It's so important as we begin to acknowledge the work that needs to happen on this land and the people, the Indigenous people and our allies that come forward with us to do this work and to begin to make a way for us to begin this walk with our ancestors on this land, and to look for solutions for the Indigenous people and the many other nations that came to this land that are seeking a way forward in terms of addressing the multitude of health and social conditions that are impacting the people. You know, as we begin to look at our Indigenous ways of knowing and doing and moving forward in ways that are going to make the journey of healing and wellness for the people, it's important for us to acknowledge where we come from and who our ancestors are. And as we move forward, to look for those solutions that are deeply ingrained in our blood memory, and also in our ways of knowing. You know, picking up our traditions, our culture, our language, our medicines, our relationships with one another. Those are important to look for solutions that we're seeking today, in that we know as we move through this work that we're doing, that it's important that we work together in unity and to work in cooperation and not in competition as we begin to navigate through the work. So today it's a good day for us to share what we know, little bit of what we know. We've really wanted to make this time that we have with the organizers and the people who are attending this conference, to make sure that we are doing things in the best way that we know how to do it, and to make sure that we are supporting the work that is being done in the past and the present, and the vision that we have for the future, for the work to continue. CAAN has been very forward thinking in terms of the visioning that we have as an Indigenous network in this land called Canada. We really rely on our Indigenous ways of knowing and doing, and put together the work through ceremony and through the elders that are part of our network on this land. We've got elders who in residence from right across from coast to coast, and they help us to move forward in all of the work that we're doing. And so today, you know, I want to acknowledge the people that from the different places on the land here that have come. I want to acknowledge the people who are knowledge keepers, the ceremonialists, the linguists, the medicine people that are part of our solution as Indigenous people, and to bring them forward as our, you know, the first researchers on this land, the first scientists on this land, you know, the first doctors on this land, the first pharmacists on this land, the first social workers on this land. You know, we've had so much beauty and richness on this land, and today we want to bring that back. We want to bring those back in terms of the solutions that we look for as we begin to make this this work move forward. We want solutions deeply rooted in our Indigenous ways of knowing and doing to come forward. It's time now that we look for those ways in our healing and our wellness that we seek for the people. And we welcome all nations to be part of the work that we're proposing. So, you know, today is a good day, and we've put together a beautiful team from CAAN, and they are going to share the many pieces of work that we've accomplished over the years, and our vision for the future. And I'm thankful for that as the CEO of CAAN. You know, I've been a bystander and a supporter of CAAN all of my life. I come from the community. I'm a community-based researcher. I'm a childbirth instructor. I'm a traditional medicine practitioner. I'm so many things. I'm a kokum to 3 beautiful grandchildren. And I also hope to be a great grandmother to many. And the work that we do here is so important as Indigenous people. We've envisioned 7 generations ahead for the work that we do. So the footsteps that I lead will certainly make a difference. Thank you. Hi.
Thank you, Margaret. That's such a beautiful way to introduce us and begin our session. I'm hearing a little bit of an echo. I'm not sure if that's, yeah, that's maybe too many mics are open. If you're not speaking, if I could ask you to put yourself on mute, please, that'd be very helpful. And so we wanted to have an opportunity to build on those beautiful comments that Margaret has started us off with in working in unity and thinking about how we're supporting our work and relying on Indigenous ways of knowing and doing. And as we think about this opportunity to all come together, we wanted to Tim, I'll signal if you can share your screen. We wanted to begin with just taking a moment to develop a word tree and invite you to contribute to telling us where are your ancestors from, where are you coming from, what are your roots, and help us to come together in that context of unity. Tim, are you able to share the screen in that process, or shall we carry on and maybe have the opportunity to share that information in the chat box? I saw that we started that conversation as well about where we were coming from. We really did want that space to bring together and celebrate how we might come together in unity across our peoples. And so we need an opportunity, or, oh, I see, as they would have it, the code to send in a comment.
You see that?
Yeah, the code, unfortunately, at the very top there, is covered up with your share your view options. Or at least it's on my screen, maybe it's... So the invitation is to go to, maybe Tim, if you could just read out the site. Or pop it in the chat as well. Is that?
Yeah, just a second. All these drop downs came in the way.
So the goal here is to have the opportunity, if you go to the website, I think it's menti.com. Is that, Jessica? Thank you. I see you've put the code in. Thank you. Yes. So if we go to menti.com, then there's a chance to just enter that the 2832-5105 and give us some insight. Help be part of the presentation with us. And then we're hoping to use this a couple times through the presentation, just to have a chance to check in and connect. So if you can keep Menti open, that'd be great. Oops, can't spell properly. Beautiful. I see a little bit of input here. Okay. Well, I certainly encourage, if for those of you who are participating, if you're interested in contributing, that's wonderful. That nations should be nations. Apparently, I'll work on my spelling, on my quick fingering on my cell phone. We'll keep moving along with the presentation, and really do welcome your input as we go along. Our first speaker, in terms of our presentations, is Danita, who is a leader in so many aspects of the work that we are part of. Tim, I'll invite you to stop sharing your screen if that's manageable. Thank you so much. And Danita, welcome you to turn on your video, or to in my current view. I don't see you yet, and would really love. We want to begin our work by recognizing, you know, the work that we do is grounded in lived experience, and you know, everything that we're working towards is meant to be improving the health of Indigenous people. And so Danita is our first speaker to ground us in that context. Thanks. Danita, I'll invite you to introduce yourself, please.
Okay. Good afternoon, everybody, or good morning, wherever you're at. My name is Danita Wapuzian, and I have two spirit names. And the first one is Lightning Rock Woman, which I got when I went into my very first sweat in 2005. And then I received another spirit name called Far Woman. I currently live in Regina, but I was raised on my reserve, Sakme First Nation, and I'm half Cree and half Soto. And I'm a cook. Well, I'm actually a kokum and a great grandmother too. I have 3 great grandchildren, and I have 9 great grandchildren, and I have 2 children. And I'm very fortunate to have my parents still alive. Yeah, on this earth. So, and I have some siblings. Yeah, so that's who I am. There's a PowerPoint here. Okay. Okay, so this is yeah, this is just my cover, and this first picture that I decided to put as my cover, it shows me, and it was taken this past summer at Fort Qu'Appelle. During the CAAN AGM, we were putting up a teepee, and so I'm here with some of my fellow Willow Warriors, part of the Kotoway Research Project at All Nations Hope. Next slide, please. Yeah, this is my, I decided to put my grandparents. So on the left is my kokum and my mushum from my dad's side, and her Kokum Ruby and Edward Wapuzian. And I was only able to find a picture of my mom's mom, her and my Kokum Mabel Pewin. I don't remember my grandfather from my mom's side, so I don't have any pictures of him. Next slide, please. This is my family that was taken a few years back during one of our Christmas dinners together. So I have, it's a strong family unit, I think. Ever since I was diagnosed in 2005, I've always had my family to support me in my journey. So this is a snapshot of my family. The next slide, please. So in 2000, I was diagnosed with HIV in 2005, and right away when I was newly diagnosed, I was introduced to AIDS program South Saskatchewan, and from there I started my healing journey. I was newly diagnosed. I didn't know what to do. I was very I didn't like my diagnosis, and so I needed help. So AIDS programs helped me. I was able to get into a life skills program, and in that life skills program, I also went into my very first sweat, and I was able to receive my first spirit name in that sweat. And then a year later, I was hired full time. I was hired to be the needle exchange coordinator, and then I was able to also, they trained me to become a peer support person. So I did that from 2005 to 2012. In 2012, I kind of reached, like, I had a lot of rock bottoms, but this was a rock bottom that I had in 2014. So I needed to leave Regina and to go and heal. So I moved away for almost 2 years. And with that, you know, I was able to ground myself And I was able to get rid of, to look after my addiction that I had at that time. So I went into my last treatment center in 2014. And in that time too, I moved back to Regina, and I was able to get my son back from the care of social services and able to maintain a stable home for us. So I'm very grateful for, my son came first at that time, and I was able to look after my addiction. So I was reintroduced back into AIDS programs. They wanted me to continue with the Anyone at Risk support group. And I also got re-engaged with the peer-to-peer program with the Sask Health Authority, and which I'm still a part of both of them still, but I've also added on with AIDS Program Saskatchewan, I also do an opiate support group called the Who's Down support group. So I do those two groups on a weekly basis. And then last year in November, I was hired at Wellness Wheel Medical Outreach Clinic as a peer health advocate. And we're in partnership with 11 First Nations communities. And I'm also a part of the acute hospital care, which is called the Opiate Stewardship Program. Next slide, please. So I do a lot of advocacy on all kinds of levels. I do it on the local level. The picture on the left is me talking about overdose crisis that we have here, and I shared a story. And I've also been a U=U ambassador in 2018, and I was part of the Strong Medicine documentary that is a collaboration with CAAN and Katie, which I'm very proud to be a part of. And I do a lot of public speaking also. Next slide, please. This picture here that I did a body map that I think a few years back, and with this body map, it really shows like how what led to my diagnosis. And then so I see gaps when I'm working. I see a lot of gaps for our First Nations people, and one of the biggest things is stigma that is really causing a lot of harm to our people. And also there's also other kinds of like different kinds of like healthcare violence and systemic racism that I speak about. And some of the people that like I'm trying to talk to and engage, there is some people that are very difficult to engage, which I'm trying to to get a handle on that. A lot of people that I deal with, including myself, we all deal with trauma and intergenerational trauma and historical trauma. And we have issues like non-disclosure of HIV status. That is also seems to be a barrier. And I see in where in my community there is like poverty, and another big thing is the homelessness that we have here, and the opiate crisis. Next slide, please. Moving forward, I'm a part of CAAN, the IPHA Sacred Leadership Council, and also on the board of directors, and also different boards like the Katie Board of Directors representing the Western region. Also on the Community and Advisory Board with SAS Stories. They have a website which it's Saskatchewan based. For my wellness wheel, what we're trying to do is create a peer network of people living with HIV. We're also wanting to do a harm reduction strategy, like a goal, a plan. It's like an innovation team. And also, I've been learning my culture a lot, very intensely with All Nations Hope. I'm part of the Willow Warrior. I'm a Willow Warrior with the Kotaway Research Project, and that research has really helped me to grow spiritually, and it's really has helped. It's helping me to do my work in a good way, and so yeah, I'm very proud to be a part of that group of fabulous spiritual warriors. So moving forward, is like I really want to help my community get healthy in a holistic way, and to support people, engage with people, and to continue the work that I do. Next slides. And I think, yeah, that's it for me. So thank you, Miigwech. And there's my contact. Thanks.
Thank you so much, Danita. That was just fantastic. I think, one of the elements of this presentation that was really important for us was the opportunity to bring to life Indigenous ways of knowing and doing and thinking about Indigenous wellness and well-being. And the way that you've spoken about your work, it fills me up to hear a reference to a research project that has been so helping you to grow spiritually, and to create that space. What a wonderful way to bring together our cultures and our teachings. Thank you, and I really appreciate it. I think again, when we think about the work that we're doing, that we are called into, and you are so important as a leader in terms of the work that we're doing with our communities, by people who have that living experience, and by somebody living with HIV who's guiding us. And I loved how you identified gaps in services, but in identifying those, you're shining light on these important issues that we need to address, right? When we're talking about stigma, and we're talking about trauma and homelessness, and how peer-led responses and harm reduction and culture will be part of the solutions. So I want to hold my hands up and thank you for that beautiful presentation. Thanks. Tim, we thought we might see if we could do another quick or short poll to ask about what it might mean to other people who are part of the call with us in terms of what meaningful engagement might look like. Are you able to open that up? Thank you. And then if we go into Mentimeter again, I don't know if we need to re-enter the number. And would love to hear, I see we've got a number of participants online. So if we can open the next question. Learn this fantastic system as we go. I love technology. It's got so many possibilities for us. And so the question that we wanted to ask was, what does meaningful engagement mean to you? If you're able to kind of set yourself up to log into the system. And I'll pop it in the chat as well so that we can have some quick answers ready for us. Maybe what we'll do is get ready for the next one, if that's okay. And let this
I actually thought I had it ready.
That's okay. There's lots of learning that happens. Good to have the chance to be engaged with our group here. So Carrie Lynn, if I could we'll move along and we'll keep getting ready for the next one. That's perfect, Tim. Thank you. And this is a presentation about a research project that we're part of that's called DRUM Sash. And so Carrie Lynn, again, I'd love for you to introduce yourself and to help us to continue to share some of what we know and understand from this territory. So Tim, I think I need to ask you to stop sharing screen for this moment, and we'll do some background work. And Jessica, if you wouldn't mind posting the PDF, that'd be great for Carrie Lynn's presentation. Beautiful.
So
over to you.
I'll introduce myself. Thanks so much, Renee. Great being here with the team, and great to be joined by some familiar people and some new people. My name's Carrie Lynlund. I am living and working and playing on the Treaty 6 territory that is also the traditional homeland of the Métis and home to a lot of Inuit northern people as well. And so I am a mother of 5 daughters. I have 3 granddaughters that one is 8 months and the other twins are 20. So there's a bit of a gap there. It took a lot of persuasion to get the 8-month going, but we're thrilled to be able to have that journey. And a wonderful partner who's very supportive of the work that I do, and that's predominantly working in communities, supporting them in the work that they want to do. And I have to say, I've been with CAAN since 2013, and I have worked with Renee for all of those years and even before in the international project, and it's been absolutely delightful. It's been wonderful and so exciting to have the freedom to do things in a good way and not be bound by perhaps ways that don't fit where we want to go. And it wasn't long ago, and Margaret, you know, you're one of my heroes when it definitely comes to leaders. You have demonstrated in the time that you've been with us the walk the talk and supported each of us where we are, who we are, and given us tremendous freedom to be able to look at really decolonizing the way that we think and work, but also in the way that we support communities. So this is really something that I hope helps to show you what that means. So my Renee actually asked me, I was a little frustrated with coordinating at a period of time. Things weren't going as smoothly as possible, and I wanted things to go smoothly, and I went to her and she said, well, can you just kind of write me a paragraph or so of what you see your position as coordinator is for the project DRUM Sash. And I sat on that for a couple of days and I just couldn't do it, because it seemed that every time I tried to put words to paper, it was I, and that is just so not how our teaching. So it's never about I, it's about we and us and together and collaborating and all of that. So I said to her, I said, Renee, could I draw a picture? And so this is my rendition. I am not an artist, but this is my rendition of my position as a coordinator, but also hoping that it speaks to you about the way that we do research with community. And so if you look at the setting, we're in a canoe because we're on a journey, and relationships with communities are a journey. And, you know, projects are, you know, basically the body of water. Yes, we have parameters in which we, you know, need to stay within, unless we want to, you know, portage and hop over. We have this body of water that we're going. And if you look at, just to set the context, there's a little bit of green coming into the trees. And that's because we as Indigenous people and Indigenous researchers are seeing community being empowered and equipped, and we're using our culture and our language. We're reclaiming and reviving and redefining how we do things to better reflect and so really we're coming back to life. We're starting to embrace through community ceremony and through our own ceremony what it means to be part of the storytelling, part of even assisting communities to write this story so that it goes on, that it's not a new book, it is a new page every time that we go on a journey with them, because the story began with the creation story, and the book will not end. We're just very honored to be part of being on the page and in the writing of that story with community. And if you see the light, that the direction that the canoe is going, we're coming out of a very dark time with the residential school. And you know, communities are being empowered, and we're headed into a better place. So the canoe represents the journey, but in the canoe, what's really important to know is that at the front is community. They're the ones that set the direction. We don't even go in with an agenda. Research with communities must be relevant and must be a community priority for them to make it appropriate. Not that it can't be because it fits our agenda. We shouldn't have one as community-based researchers, but we can certainly work and support communities to achieve theirs. So here we have community in the front of the boat, steering and making sure that they're going towards where they want to go. In the middle is the team, the research team. And they come in all shapes and sizes. And then behind is the elders. Now, some of us, and I'm not that young, but in comparison to our elders that work with us, I'm younger. Some of us have in the past, I can only speak for myself, thought that I was going on a new journey. My elders remind me that, you know, and if we use this picture as an example, we're thinking, oh, we're on a new adventure. And the elders are there to remind us through their stories that this pathway has been traveled many times before. That, you know, the things may have changed a little, but this is not new. These waterways, these pathways, these have been journeyed, and they tell us about those stories. They share with us what it was like in other journeys when they traveled, and they remind us of our responsibility to travel in a good way with each other, to be respectful of each other, to acknowledge the land, and to you know, just to guide us in how to write this story so that it honors the journeys before, honors the elders and the ancestors, and that it will also be a story that will be helpful for generations to come. And then there's me. Now, I took the liberty of taking 20 or 30 years off of me in the picture, but hey, I'm the artist, I can do that. But my position is simply to keep the back of the boat going forward in the same direction as the front of the boat, so that, you know, it's my role is not to jump in and start paddling in the middle. And I think that's where my frustration had come, because there was maybe a paddler that was, you know, not maybe paddling in the way, or maybe laid the paddle down for a while, and I jumped in, and I couldn't keep the back of the canoe going in the same direction as the front, because I was in another position. I was rowing in the middle, and it just was letting the back sway around, and the journey became rougher than it needed to be. So this was really helpful to me. My role is to make sure that the people in front of me are given as much support as they need to enable them to paddle in a good way, and that we paddle together. Now, I want you to look at, there's one paddle that's out of the water. Now, that may be a research student, that might be an ally. They want to be on the journey with us, but they just are not understanding how to paddle. But do you notice we're not sinking? The canoe is not, you know, in danger. There's enough people there to make sure that we stay afloat. And my supporting, and the rest of the team and the elders, hopefully by the time that we get to the end of our journey in this particular one, that person will be able to paddle in rhythm and in a good way, so that the next time they're invited to join a journey, that they'll be able to jump in, grab a paddle, and be able to go that way. I also, Drew, I don't know if any of you are canoers, but the deeper you put your paddle into the water, the stronger a pull you have, and the more that you can push something forward or draw back and stop. If you notice, the elders' paddles are deeper into the water than the others, and that was intentional because we are grounded, and they keep us. They certainly help me. Sally here in the boat is one that I speak with weekly and run things by to make sure that my thinking is appropriate, that the words that I'm looking for are appropriate, that it's respectful, and she assists me. I speak Cree-Michif, but she helps me with some Cree words that we need when that is necessary, because the English just wasn't working in some of the conversations. So just to give you this picture, and I think maybe just to draw it out bigger, going forward, pictures are going to be used in reporting. Can you imagine going to a conference where things were described in pictures rather than a slide that was jam-packed full of words? I mean, and so I'm just encouraging you to stretch a little bit and go, what could you say in pictures that you can't say in words? And yes, I know there are some things like data and maybe some different graphs that might not fit a picture per se, but there's lots that can be. And I think I'm hoping, and please give me some feedback, that you get what we do with community, you get where they're at in the canoe. And so my question often is, when I show this to community now, and so where do you see yourself in the canoe? And maybe something like this would be a useful tool for you. Hi.
Thank you so much, Carrie. And we really wanted to have this opportunity, and so appreciate your reflection to think about that process of journeying to a better place, and how you've highlighted the partnership development and the supports that are necessary as we all work together and bring those experiences, particularly from our particular project, the DRUM Sash project that's operating in Alberta, and finding our way to really think about bringing Indigenous ways of knowing and doing from those previous journeys that have happened before us, and how we bring that into the activities that we're part of today, and build and contribute to those stories from before to begin to write our story now. That was really beautiful. We're going to jump right into another speaker and invite Trevor Stratton, who is coordinating our international Indigenous engagement work. And this is a presentation that helps us to look at the past, the present, and the future work of the International Indigenous Working Group on HIV and AIDS, and also some growth that's coming into that. So Trevor, I'm going to jump right over to you, and appreciate if you can introduce yourself, please.
Thanks. And I want to thank Letitia for helping me with the slides. If you could throw up the main slide, the opening slide, I'll just introduce myself while you make it all full screen. Yeah, I'm Trevor Stratton. I'm a citizen of the Mississaugas of the Credit First Nation, which is located near Brantford, Ontario, near Toronto. Toronto and like Hamilton and Niagara is our traditional territory, which we share through the Dish with One Spoon territory with the Haudenosaunee people, the Haudenosaunee Confederacy, also known as Six Nations of the Grand River. I was diagnosed with HIV in 1990 when I was 25 years old. That was 31 years ago. So, and I work with CAAN, but I'm not just the how do you say it? I'm not just the coordinator of the IWGHA. I'm also a volunteer or an interim executive director for a new NGO, and I'm going to be talking about that as we go forward too. So let's move on to the next slide. If you like pictures, you'll like my presentation. For 3 decades, Indigenous peoples around the world have been on a path leading towards an International Indigenous Working Group on HIV and AIDS. So let's keep going. I have lots of slides. Early collective action started as early as 1989, and this is a photograph from the Montreal International AIDS Conference, where people living with HIV stormed the stage and demanded to be heard, and created something called the Montreal Manifesto, which basically was saying things like, we're not victims, so we're only occasionally patients. We are people living with AIDS, and we will be heard, and there will be no more meetings without us. So there was some very early activism in those days that inspired us and continues to inspire us. Next slide, please. So there it is, the International AIDS Conference in Montreal, and leadership back then was provided by the National Native American AIDS Prevention Center, also called NAPC in the US, and by the Te Rupu Tautoko Trust in Aotearoa. I never pronounced that properly, New Zealand. And there was the very first International AIDS Conference was hosted in Auckland, New Zealand in 1991. At a time when they really didn't have any funding for international work. So they went into a little bit of debt, but they knew that it was really, really important to do this work internationally. Please, next slide. So there's a whole list of things that have been happening. So like I said, 1989 was, they were meeting as early as 1989, but fast forward many, many years later to 2005, and a grouping of Indigenous organizations got some funding from the Canadian government to host the very first International Indigenous Peoples satellite before the big AIDS conference in Toronto in 2006. And that group put together, the planning committee put together what's called the Toronto Charter. And that was a call to action. And the very first time Indigenous people spoke publicly as a group on the global stage. Then, you can see every 2 years, they went down to Mexico City in 2008, which was another satellite or pre-conference, in 2010 and 2012, etc. And I'm going to work us through that a little bit through pictures. So next slide, please. There's the logo. I finally found it. I looked forever for this logo, and that's the best I could find. And it's from our Indigenous satellite at AIDS 2006. And each year we try to come up with another logo. So next slide. And here's the logo from Mexico City. And in Mexico for AIDS 2008, where we had our pre-conference, we always partner with the local Indigenous people of the land. And Mexico was no exception. And we let them take the lead and let us know what is the context here and how should we frame this pre-conference. And for this one, it was Indigenous peoples and Afro-descendants working together, because in many countries in Latin America, that's how it works. They do work together, and they are a solid movement, or a grouping of people demanding action. So next slide. The year after, the Canadian government hosted an international policy dialogue and invited Indigenous experts in HIV who were responding to HIV from all over the world to this policy dialogue in Ottawa. And there was a point where the Indigenous people said, okay, we want to have a meeting just with us. And so all the government people, please leave the room. We need to come up with some recommendations. So next slide, please. And there's one the recommendation one, support the International Indigenous Peoples Working Group on HIV and AIDS. So that working group suggested that CAAN, that was called Canadian Aboriginal AIDS Network back then, continue its leadership role in convening meetings of the working group, and that CAAN seek support to convene the working group with support of the federal initiative, this funding initiative in Canada for HIV. So next slide, please. And they actually did do that in 2010, when the International AIDS Conference was in Vienna, Austria. Obviously, we couldn't find any local Indigenous partners to partner with. So we turned our focus on just strategic planning, and everybody put their heads together and came up with not only, you know, we tried to talk about strategic planning, but inevitably the group was talking about how are we going to govern ourselves as a working group as well. So when I came on in 2011, please, next slide. I had a big, you know, pile of notes and papers, and I had to pull apart the papers that were about self-governance or governing themselves, and that turned into the terms of reference. And the other pile of papers turned into this strategic plan for Indigenous peoples and communities from 2011 to 2017. So that was my first task as I came on in 2011 with the working group, to pull together all this work and try to give it back to them and say, is this what you said? And we finally got it right. So next slide. And then we went off to, with our new strategic plan there, we went off to Washington, DC. So not only do we have a pre-conference before the International AIDS conference, but we engage fully at the conference itself. So obviously academics and researchers and community people submit abstracts to participate in the big giant program for the International AIDS conference, but we also participate in the global village, which I would say would be the heart of the conference. And the, you know, the science program is the brain of the program. So, you know, we do something like this and have a grass dancer, and a crowd would come around, and then we'd start talking about Indigenous harm reduction, or, you know, the Declaration on the Rights of Indigenous Peoples and stuff like that. Next slide, please. And again, this is in Washington too, but this is not at the AIDS conference. This is at our pre-conference. And this was one of the projects. A bunch of Indigenous people came down from Canada, and this was called Visioning Health, an HIV research project working with Indigenous women living with HIV. Each of them were armed with a camera or some art making stuff, you know, painting or whatever. And they went out and took pictures and created imagery that represented their experience living with HIV. And then they would write, you know, a paragraph underneath these images. And all these images were displayed in this traditional healing lodge in the lobby of our hotel in Washington, DC, where Indigenous peoples reclaimed some territory in the nation's capital. The data that came out of this was really quite robust and really deep and insightful. And when you go in there, there was a feeling that you get from reading the words and seeing the images, but just being in that healing space. Thanks, Leticia. Next slide. So we also get involved with the CAAN in research, and Renee, thankfully, has been shepherding our group and pulling us into research teams. And with this particular one, we were looking at creating some kind of protocol to help people, not only non-Indigenous, but Indigenous researchers as well, to do research work with Indigenous peoples. And we called it Values, Approaches, and Guidelines. And we did it to provide these guidelines to assess the application of ethical principles and the main methodological approaches in developing research projects, and to provide a framework, right, to have a respectful involvement and to offer this model of research design. Next slide. And in Montreal, Melbourne, we attended, this is the Global Village of AIDS 2014 in Melbourne. And we decided, I forget why, but we had our pre-conference in Sydney, Australia. And then the ones that were going to the AIDS conference flew to Melbourne and continued engagement in HIV workshops and stuff. And here you can see there's a convergence of different cultures here. There's Maori people standing there playing guitar and singing a traditional song. On the floor there, you can see a map that's a Maya, some kind of Maya Quiche kind of calendar. And then on the walls, you see all these handprints and artwork from Aboriginal people in Australia talking about nothing about us without us. So, you know, that's what happens. We get together and we do this cultural sharing through our networks and our communities and our alliances. Next slide, please. We also go to New York City to the United Nations headquarters, to the United Nations Permanent Forum on Indigenous Issues. We went there in 2013, or was it 12, right around then, and we submitted a joint intervention on the floor of the forum along with the Native Youth Sexual Health Network, and we asked for, we recommended that they hold an expert group meeting on sexual health and reproductive rights. And it's not easy to get Indigenous people at the UN to talk about sex, to talk about HIV, to talk about drug use and things like this. So, and yet they did it. They held an expert group meeting the next year. Next slide, please. And there's, you know, those things outside the UN chambers, and we had our expert group meeting, and two of the experts that they called in were from our working group, from the International Indigenous Working Group on HIV and AIDS. And they created a report that we picked up years later, and we actually used some of the recommendations. Next slide, please. You can see it generated a lot of attention. So we had the media come in and interview Clive Aspen. His SRHR presentation was specifically on Indigenous peoples and HIV, and it was called Research and Community-Based Responses to Reduce HIV Disparities. One of the things that was pointed out is the lack of trust by Indigenous peoples toward, you know, the medical system, and how that is really impeding Indigenous access because of the experiences that Indigenous people remember from their families and from our communities historically, being involved in institutions such as, you know, the hospitals and the medical response. Next slide, please. Fast forward to Durban, South Africa, and there is former Health Minister Jane Philpott sitting down with a traditional healer at the African hut that we built in a partnership with ProMitra South Africa and ProMitra Uganda, when they built a beautiful African hut, which was like, I think was one of the most we had one of the most interesting networking zones in the Global Village that year, and lots of activities, again, with that convergence of Indigenous people from all over the place. And it was, in every context, it's different, and it's very politically sensitive when we walk into a new territory and approach the Indigenous people and say, how are we going to frame this? So you can imagine in the Southern African region, trying to determine who are the Indigenous people and having a discussion with the Khoisan people, and talking about indigeneity in Africa. So you can imagine some of the liabilities, or the delicacy, how delicate an issue it is, and how we need to get it right by working with the people who live there and who understand and who have the lived experience to be able to guide us to be able to do the right thing and have our conference in a good way. Next slide, please. Trying to whip through here. Where else do we engage? We also engage at the Joint United Nations Program on HIV and AIDS. Their Program Coordinating Board, or PCB, lives, it happens in Geneva at the big WHO building. And this is, the PCB at UNAIDS is unique in the UN system in that civil society actually has a say in the decision points. We negotiate. I did a 2-year term with a 1-year extension, and represented CAAN there, and you can see us there doing an intervention. That was a quarter for prevention, and we were holding quarters up while we were reminding all the member states that 25% of their AIDS budget should be going toward prevention, for example. So that was a big education that really pushed us forward as a working group to understand intimately the global HIV architecture or infrastructure. Next slide, please. And we also built relationships with UN agencies. And there's, here we were in Amsterdam, Holland. Again, without having an Indigenous partner on the ground, we were focusing on partnerships with non-Indigenous agencies and entities. So, you know, we invited different UN agencies, and Michel Sidibé showed up and did a keynote speech for us, and we had WHO there, and the Pan American Health Organization, and other government representatives from Canada and other places. And by this time, we had created our second strategic plan by the time we got to Amsterdam. Next slide, please. We did some work with, you remember I was talking about building relationships with UN agencies. UN AIDS actually has 11 UN co-sponsoring agencies that support the work of UN AIDS. One of them is ILO, the International Labour Organization, who approached me and asked if CAAN and IWGHA would be, IWGHA is the International Working Group, would be interested in looking into stigma and discrimination experienced by Indigenous peoples living with not only HIV, but also TB, but in the workplace. So thankfully, Renee was really hands-on, and her and I we did a lot of the leadership and pushing forward to get this done. And we came up with a pretty good report and also an infographic. And we tried to make it more interesting and a little bit catchy and punchy to the eye. So people would actually pick it up and read it. It wouldn't just be another report collecting dust on the shelf, you know. Next slide, please. I keep trying to hit the slides myself. And there we are at the permanent forum that we stand up and we say, yes, we're living with HIV. Yes, I can tell you that stigma and discrimination is still alive and Indigenous people are being left behind, stomping our feet and crossing our arms and, you know, crying a little bit and letting people know that we're not happy. We need more attention from Indigenous communities around HIV. So we go to New York and try to get Indigenous people talking about HIV and sexual health and drug use and things like that. And we go to Geneva to get the big global AIDS response to pay attention to Indigenous peoples. So it's interesting. We try to bring them together and you know, marry them together so they start working together. Next slide, please. Getting to the end here. There we are in Mexico City. You can see Renee there with the microphone, and I'm holding up the sign, and there's Amaranta Gomez, one of the leaders from Mexico. We interrupted the opening ceremonies of IAS 2019, and surprisingly, they kept the cameras on us. They projected our image up on the big screen. They left the microphone on, and you know, all the cameras came right to us. It was, and the lights and everything, and we did our 2-minute spiel in our list of demands. And we made the morning papers the front page, and we were shocked. Actually, we had never done anything like that before, and all of us were a little bit out of our element, but we did what needed to be done. So, next slide, please. And this is what I'm going to close with. I told you we created a new NGO back in 2016 called the International Indigenous HIV and AIDS Community, which we affectionately refer to as IHAC. We threw together the bylaws, a finance policy. We opened a bank account. We created a 10-point statement to get the attention for a launch that we did at the Permanent Forum on Indigenous Issues in New York City back in 2018, along with the press release. And one of our very first wins is that we became a civil society partner with the International AIDS Society, the ones whose conference we interrupted in the opening. And we were partner for 4 years, preparing for AIDS 2018 and AIDS 2020. So that gave us a bit of a boost as well. Next slide. And IHAC right now is working in 2 different countries on an income generation projects, or I guess you could say microfinancing. And again, it's with the ILO. The International Labour Organization knows me and knows that CAAN and my work through CAAN and with Renee was pretty good. And so that because they had a relationship with me and with CAAN, they decided to take a chance with this new organization called IHAC. And they gave us, you know, some money to do some transfers. We worked with Promitra Uganda. And in that country, this Indigenous group of people living with HIV or affected by HIV is they're growing herbs and medicines, and they're harvesting and processing them and packaging them. And that's it's not like the cure for HIV. We're not that silly, but it's for you know, common ailments like anemia or maybe worms, stomach worms, and toothpaste and things like that in Uganda. And so you can see they've had all this machinery tailor-made, and they're working with the regulatory bodies in the country to make sure everything is certified and that no one would get hurt and that the products are safe and efficacious. Next slide, please. And this is the other country. We're working with an organization called Surawat in Nepal. And this is a group of Nepalese indigenous people who belong to an LGBTI group. And they're using yak wool to make sweaters and scarves and gloves and stuff like that, and being raised out of poverty while COVID-19 has disrupted their livelihoods. Next slide, please. And that's it for me, but I want to let you know, if you don't know already, that the next International AIDS Conference is once again coming back to Montreal, and that'll be July 29th to August 2nd. And our pre-conference will be July 27th and 28th. And we hope to see you there. And we'll be featuring a lot of the different kinds of activities that I've sort of given you a glimpse to here. And we really look forward to having a really good time in Montreal and sharing all of our Indigenous knowledge with each other and with the world. So thank you. And back to you, Renee.
Thank you so much, Trevor. That was absolutely fantastic. Oh, I just lost my notes. There we go. So as we think about this session about, walk with me and how we bring culture, behavior, and health into the work that we're doing and the ways that we're doing, I hope that we've had an opportunity to begin to highlight some of that. And Trevor, I love to how, you're starting and grounding us in social action and activism and how that's fueled our collective actions and how you pulled that all through the presentation with highlights from the events and activities that we've been organizing over many years and those beautiful moments of cultural sharing and both how that's kind of incorporated into the spaces that we create as well as the actions that we take in those places, while also being mindful of the delicacies. That was a good choice of words that are required, when we're trying to respectfully engage around the world and build those relationships both across CAAN and many of the projects that you and I have had a chance to work on, but also that work and that relationship building that happens around the world. And so as fate would have it, and as we talk about our health and well-being, one of our colleagues had been planning to speak in the closing of our session today, and she has prepared an amazing, fantastic, brilliant presentation that I cannot do justice to. So Jessica, if I could ask you just to pull up the short slide deck. This will be please stay tuned and watch what CAAN is up to. Check out our Facebook page, check out our website. Keep listening, and I have the opportunity to just share some insights and an introduction to a new project that we're working on. And so this is a recently funded research project, and it's co-led by an international team. So again, all of this work that we've been talking about, the ways that we're thinking about building partnerships, the connections that we're making around the world, the time that we're spending together, meeting each other and hearing from our community of what's really critical and important to address, particularly circling right back to the beginning of our presentation, to Danita, to the points that you were raising in terms of how we think about responding to stigma and discrimination. Margaret, how we work together in unison. We've pulled together this project with the incredible name, and we're very creative with our naming processes. So the International Indigenous-led mobilization of the United Nations Interagency Support Group on Indigenous Issues and the World Health Organization Consolidated Guidelines for Sexual and Reproductive Health and Rights of Indigenous Women and Girls. So all of that is what we're going to influence by leading an intersectoral response through community-driven self-determination and research. And in this project, we are working with partners from Nigeria, Guatemala, Nepal, India, Aotearoa, New Zealand, Peru, and of course, this project is housed here in Canada. And as we're doing this work, our goal, and maybe we can move to the next slide, is to begin to develop training and policy-related materials related to sexual and reproductive health rights for Indigenous women. And we're working on using terminology. I know that the Women X is a sometimes effective way of representing the work that we're doing, and sometimes a bit delicate, as you said, Trevor. So, our intention in the way that we're presenting and framing this project is really to be mindful of looking for ways to be inclusive and make sure that we are signaling that inclusivity. And so over a period of 5 years, working across 7 countries with Indigenous peoples, we're working to both build capacity in terms of build capacity in terms of the research work, particularly emphasizing data, access to data, the collection of data, the management of data, and the interpretation of data, so that when we're working with those governments, when Trevor's in those international forums and has those opportunities, that there is information and evidence in hand that can be used to be influential. And we're also very mindful, and again, in that Indigenous way of knowing the world, that when we talk about the sexual and reproductive health rights of women, inherently and absolutely, that includes the health and rights of Indigenous men as well. And so we're framing this project in this context to make sure that we're relevant. And by working with our partners across these countries, our goal is to both influence local contexts as well as draw lessons from across all of our different country contexts to be able to be influential at a global level. And if we were able to go to the next slide, this is just a little bit more of the context of the specific goals and objectives that we are going to continue to pursue to achieve our goal of being influential locally and globally. And so this is really looking at measuring the sexual and reproductive health rights, responding to the needs of Indigenous women and girls in the global context, to think about how we're integrating Indigenous knowledge through the entire project, from the design, development, dissemination, and evaluation processes, working to uphold equity, gender equality, sustainable development among all the populations that we're engaging. And you can imagine across these very diverse countries that the populations and the ways that we'll reach those populations is going to be pretty exciting and diverse. And this project will enhance the ability of Indigenous women and girls and the men and boys who surround them to engage in all levels of research while strengthening our Indigenous and global allyships. And so really, again, this work that we're thinking about as we walk together and how we walk together, what it might look like to begin this project. So I'm so excited. I wish that Patricia had been well to be able to present today. I know you're here listening in, Patricia, and I hope that I know that the next time we have this opportunity to share, this is a project that you want to be watching for and listening for. So pay heed to international conferences to come. All right. So we come to a point where I hope that we have been able to explore the intersections between culture and health in general and offer a first voice perspective that has been meaningful and talked about the way that we engage meaningfully with Indigenous populations in Canada and around the world. We're going to give the Mentimeter one more try. Perhaps while we're setting that up, opening the door for any questions, any comments. We can look in the chat box. I'm not sure if there's other alternatives from our CAGH team, if people have the opportunity to raise a hand or to give voice to a question. Happy to be watching for any comments from the audience at this point. Okay. Well, anticipating the possibility of facing a big screen with lots of boxes and not being able to look around the room, we did have some thoughts about some questions that we wanted to follow up. Tim, might I maybe shift over to you and ask you to introduce the questions and see if we can, we'll try this fantastic technology one more time and see what we can do with Mentimeter. I was hoping you might be able to unmute, Tim, and just guide us through these.
I had to change screens to unmute because apparently it doesn't like this. I'm still working on one screen. I'm so behind technology. Yeah, I can do this. So We had 3 questions. I can go through all 3 if I can figure out how to do this.
Thanks, Tim. So we have that, you've put the link for mentimeter.com and the code for this session in the chat. Thank you for that.
There we go. And we're up. So part of it is just, not that we're looking to replace Trevor, but EHAC in its next iteration is looking for some guidance and some leadership as Trevor transitions away from that. So one of the things that we want to know is what roles and activities would people hope for in that international venue.
All right.
Just trying to change slides, but it's not liking it. Oh, there we go. Let's see that.
Yeah, I see something has changed on my screen.
There we go. And just understanding Indigenous ways of knowing, both from a Canadian perspective as well as an international perspective, as Trevor was talking about, is one of the things that we want to keep top of mind as we do this work internationally, and treating that with respect and honoring that as we move through.
And Tim, I don't know if there's a way to just scroll down, because I see there's actually 3 answers that have been entered in that question already. And there's I see on my screen a chance to be able to like or comment on, which is great.
We've got that. As you'll notice, all these answers are anonymous.
A little bit of space to be able to make our comments.
It's always good.
Yeah.
So I've just got.
Thank you, Métis. Sorry, go ahead, Tim.
Oh, I think I was just. Yeah, and then did I have, what was this one? There we go. And that's the, yeah, those are the 3 questions.
Perfect. Oh, see,
That's what happens when you learn a software first thing in the morning.
But I also see some comments, and again, we have the opportunity to try and use this technology, which is, you know, sometimes a little bit of a gamble, but also comments in the chat box, which we really appreciate. So if Mentimeter is not working for you, please feel free to use the chat box, and we'd love to have that opportunity to engage with people who are attending the conference. And so I see the comment from Letitia, but that thinking about Indigenous ways of knowing and doing, frameworking health, wholeness and well-being, doing that Indigenous ways of knowing and doing are for and by Indigenous people, and then agreed upon by 3 Indigenous nations from across the world, our blanket document, so that there are ways of thinking about, I think, Letitia, if I'm understanding that, thinking about how we come together, and how we build consensus around the world. And yes, exactly, Trevor, that disaggregated epidemiological data for Indigenous HIV in different countries. And that's certainly some of what we're hoping that we're going to learn about gathering and reporting and analyzing through our project with International Indigenous Women's Sexual and Reproductive Health Rights, that we will set a stage for data gathering and reporting. Not quite at the level, perhaps, of a national surveillance program. All right. Well, I think that I get to come to the point of the day where we thank everybody so much for spending this time with us, and I certainly want to thank our fantastic and beautiful speakers, and so deeply appreciate the time and energy and effort that's been put into coming together, and the amazing, incredible work that each of you do, and of course I get to call you colleagues and friends, and that's a deep privilege. But I think that you know, on behalf of our communities and our peoples, you are leading us in really, really important ways. As is always important in events such as this, we also would like to take a moment for evaluation. And so perhaps we'll learn in the ways that you're using evaluation, Jessica, and the CAGH team to introduce a poll, or I know that you have a couple of key questions that you wanted to present. And thank you, Margaret, to see your last comment there about ownership by Indigenous people with permission required for sharing and accessing that data when we think about how we engage in research work and in the collection of information about Indigenous peoples. So there's an opportunity then for each of us to give some feedback. And this session has been brought to you with kind funding provided to communities, alliances, and networks through the Public Health Agency of Canada, Indigenous Services Canada, and the CIHR. Probably important to note that for the record as well. Thank you.